Welcome to this special edition of Conversations on Cannabis, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. I'm Heidi Otway, and on this program, we're talking about cannabis and mental health. Our guest is Dr. Martha Wisbey, the Assistant Clinical Director at Impact Behavioral Health. Dr. Wisbey, thank you so much for being a guest on Conversations on Cannabis.
Thank you for inviting me. I'm glad to be here.
Great. So with the November election, the pandemic, the upcoming holidays, it's safe to say that many Floridians are probably going through a tough time mentally right now. Can you share some of the most common types of mental health disorders that people may be experiencing?
Well, given all those things that you just mentioned, certainly anxiety is heightened in terms of mental health, but typically, mood disorders, depression, persons with maybe some more severe bipolar kind of traits and features. But I certainly think that given what you just mentioned in terms of what's happening around us, it's a different type of mental health because it's folks that maybe never have had some things that have gone on that have caused some things that they have to address that are causing them anxiety is the primary one. And depression and isolation, to be honest, yes.
Yeah. So what are some of the warning signs that someone may have a mental health disorder?
Well, I just mentioned isolation, but certainly, when folks aren't functioning fully in terms of eating and sleeping and doing their daily activities. We have a questionnaire that we ask when folks come to our center. We actually, find out a little bit about how they are day to day caring for self. And, feeling down and depressed, not feeling good about, yourself. The extreme is not wanting to live if someone gets to that place. And that, it varies, but it disrupts the day-to-day functioning, and folks are not what they typically would be, and so they need to maybe stop and take some time to address that in a clinical setting. And, that's sometimes hard, but it's great if they do avail themselves to therapy.
Yeah, that's good. So there's been some research over the last few years about the use of medical marijuana as a treatment for mental health disorders. What are you hearing about the research findings?
So the only thing, and I've read because I was, I'm really interested in understanding a little more because 11.8 million young adults are kind of trying to, not medical marijuana necessarily, but are using recreational marijuana.
Which is illegal in Florida.
Right. So it definitely has been a different thing to see, but I see it a lot. The medical marijuana piece, what I saw in the research is for PTSD, which is post-traumatic stress. And I don't like to emphasize the disorder, but it's post-traumatic stress. It has been effective for the symptoms of hyperarousal, nightmares, and then also just avoidance. So PTSD is the one that I've seen that medical marijuana has been vetted out, and there's a little more to it. Other mental health issues, I haven't seen a lot that's really supported the use of medical marijuana.
Yeah, PTSD is one of the qualifying conditions to get a medical marijuana card in the state of Florida. What are you seeing in your practice as far as medical marijuana as a mental health treatment, and not the unlawful,
I got you.
Illegal, but also, people who actually went through the process of going through the Florida Department of Health and a licensed medical doctor to get a medical marijuana card. What are you hearing about that as a treatment in your practice?
So primarily, I see people with anxiety disorders, pretty severe anxiety disorders, really asking for and needing the medical marijuana card. But the two, and these are not mental health only related, but is sleep and pain. So that, again, it gets into the medical piece of why folks are seeking this kind of support and actually going through to get the, legitimate card, and then go to dispensaries and find the type of strain or whatever they need to actually address their symptoms. And so those are the ones primarily. Anxiety is tricky, but again, that is one that I do see a little bit more that folks are seeking support with.
Are you seeing have you seen an increase if you were to compare this year to last year? Have you seen an increase?
Yes, I have, definitely.
Yeah, pretty significant.
Yeah, pretty. It's the numbers are not high because again, I also see clients at the expense for getting the card, the expense for just there's things that need to happen in terms of education about using medical marijuana and finding out, what is the best thing. And so I think, but I have seen the answer to your question is I have seen an increase for sure.
Okay. Can you share maybe from your perspective, what are some of the benefits of using medical marijuana as a mental health treatment?
Yeah. So legitimate use is really beautiful. I mean, making sure that you're legal and then having support of, I think a doctor, someone who's actually looking at the paperwork and understanding what your medical need is and really doing it in a way that is helpful, the most helpful. I think that's one of the greatest benefits. I think it does, again, when we talked about PTSD and we talked about anxiety, I do think that there are individuals that are finding that there is some significant support and help for their symptoms. One other area with CBD in particular, I saw one research thing that said that psychosis in folks that have maybe schizophrenia or some psychotic features, that perhaps CBD could also address that. And so that's another benefit that I saw in the research. I haven't necessarily seen it in my practice.
And so would you recommend that in addition, like if someone were to go through the process of getting their medical marijuana card, that maybe in addition to going to the physician who issued the card, maybe coming to someone like you for behavioral health therapy? I mean, is that a benefit?
Yes, that is the way to, I think, do it, because you need to kind of, you can't just get a medication without also having support when it comes to mental health. And so I think that really, truthfully, that is the great way to do it, is to come get a good therapist, get somebody that you have some trust in, and that you will work with. And so the reduction of symptoms can occur, and even maybe your use of any kind of medicines. And that includes psychotropic medications that folks, are also prescribed. But yeah, I definitely think therapy is needed. And I look at behavioral therapy because there's some mindfulness, meditation, calming. There's some things that assist folks in managing in a way that is more natural and can work.
Yeah. So what are some of the risks that are associated with using medical marijuana for a mental health, as a mental health treatment?
With any substance, I guess, I can't just pick out medical marijuana, but with all substances, any type of addiction and like dependence of any type that is really, a client can get attached to something that they think is the answer to all symptoms, and it can really lead to worsening and heightening of things with use that's daily and not done prescription wise. Maybe sometimes folks will, sometimes think this is the miracle, and then they might abuse it, and so that's a risk for sure. That's pretty much, and then of course, so that's really one of the major ones I could really speak about. Yeah.
Right. I'm going to do a quick station break. For those of us who are just joining us, I'm Heidi Otway, and you're listening to Conversations on Cannabis with Dr. Martha Wisbey as our special guest, talking about cannabis and mental health. Dr. Wisbey, let's continue with our conversation. And I wanted to ask you, if people are not yet ready to get a medical marijuana card, what actions can they do to improve their mental health?
So I think we touched a little bit on that, but therapy, availing yourself to talk to a therapist, finding a good one. Some clients are actually medication management. They can actually go to a psychiatrist and get assistance via psychotropic medications. The natural way and the good way that I really hope to help clients with would be finding a resource that is going to just reduce symptoms overall. And again, it goes back to what is self-soothing and identifying that for a client. And it could be, walking daily. It could be getting an animal that,
I'm hearing a lot of people got pets during the pandemic.
Right, pets. And then it could be just having maybe even a network of friends. Some folks, it is going to groups. So they're, again, online, a lot of it's virtual because of our pandemic, but it's connecting to folks, and it might be virtual, but it's still helpful. So identifying the things that can really assist in reducing, the pressures, the anxieties. And a lot of folks, it isn't a clinical mental health issue. It might just be based on situation, what's going on today. And so it's not necessary that it's going to be medication that's the answer. It is going to be, we have to help with the situation and what can we do? And so it's thinking outside the box sometimes. And that's what we do in therapy. And there is outpatient programs that are offered with really good group work, and because peer-to-peer, people talking to each other and exchanging information is really helpful, because folks tend to find out something that could work for them, and it's just a really great way, even though it's a pandemic, it's a great way to still make those connections.
Oh, I just love what you just said, because earlier you mentioned about isolation, that there are people that are experiencing that. So if someone is watching and listening to this, could you provide some resources or some suggestions of where they could go? I mean, we're all using our mobile devices, our computers, and our laptops to help us stay connected with the outside world. Do you have any recommendations for where people can get resources for this peer-to-peer connection?
Yes, National Association for Mental Illness, NAMI, is a really good local and also national, but it certainly has meetings, and there's a great support network. In our area, we have, 211, we have the helpline that is really the Big Bend area that really is beautiful too for folks to connect to for help, and any type of help. There is also, I mentioned AA and NA groups.
And that's free. And that's actually free.
All free. And then I don't know if on college campuses, there's something called Active Minds. NAMI also has some associations, but Active Minds is wonderful for college age clients. And then there's a substance abuse and mental health group, SAMHSA, that has resources online. So it's it would be something that folks could get some information about and good resources from. There's online stuff from the National Institute of Drug Abuse as well. So that's another resource, but it gives information for connecting people. There's online groups for almost anything, and you just basically Google. And on the whole, you want to make sure that obviously they're vetted out, not something that's, not going to offer the help, but it's typically there. And I really encourage clients during this time, especially, to go ahead and find those connections. There are in-groups meetings, like we have on Tuesdays and Thursday evenings. We have in-group meetings, and we do social distancing, masks. Mm-hmm. So there are some groups that are also meeting, which is helpful. And I think AA and NA has also opened up a few meetings as well in town, and I'm sure throughout the nation. But the online piece is critical.
Yeah, I would agree. Well, thank you for all those amazing resources that our viewers and listeners could access. And we also want to encourage people to visit the FAMU Medical Marijuana Education and Research Initiative website, and also the Florida Department of Health Office of Medical Marijuana Use, where you can learn more information about how to obtain a medical marijuana card. Dr. Wisbey, is there anything else you'd like to add that we didn't cover today for our viewers and listeners?
No, except that one thing that I always just say that asking for help is hard, and people, really, it's not a vulnerable, weak thing. It's a really strong, important thing to address, whether it be you or a family member. It's just mental health has a stigma, and the stigma can stick, and folks are scared. And so I just want to encourage people and to demystify it, and to let people know that, you can find someone you can work with, build that relationship, and then really start to get healthy. The idea is to get back to whatever we call typical living, or, the new normal, whatever expression you want to use. But I would say that, to not stigmatize the concept of mental health and what people have said to you about it. Oh no, you don't need to ask for help. Just talk to friends, and I think professionals are the way to go, and certainly objective professionals can offer some really good help.
Yeah, and I know that in your practice that you've worked on, you've done research and some work on, diverse populations and multicultural individuals. And there's a huge stigma, especially in the Black community and the Latino and Hispanic communities about mental health. Can you address that a little bit?
Yeah, I mean, you just hit the nail on the head on that one, because that is really what I hear a lot. And it's okay, I get it, I understand. And so what we do in our practice, because we're in integrated healthcare, is that when folks go to maybe see their primary care physician or an ARNP, and they have needs that come up that are mental health related, we actually kind of refer them to the mental health piece of us. And that's a really nice handoff, or way in which we say we're a team, and it's holistic. You're a whole person. Your mental health is a part of your physical health, and they're highly connected. So, I certainly think that especially, but we do see that a lot, and we do know that it's difficult, and we do have interpreters for folks that come from the Latino community and need that kind of support for family at this time. And with the Black community, it's been outreach, and I think if we do a good job, I think then that is really shared, and ideally that's how helps breaking down those
barriers. And would you say that over the we're seeing more and more conversations nationally about people of color and mental health issues, trying to break those stigmas, which is great, because it's more of a normal behavior. It's okay, it's not, you're not a bad person, so are you seeing more people of color coming in for mental health support now that we're starting to have these more honest conversations?
So our practice is so wonderful about diversity, and it's why I work here. So I think that it's more based on the mission and philosophy of the space that I work in. But I'm not sure, because really that is a focus that we have really paid attention to. But yes, there's been demand with youth in particular, adolescents and younger folks. So there has been a little more referral based on that, I would say.
Well, that's good. That's good. I mean, any increases that we could get in the practices is progress, right?
Exactly.
Yeah.
And we're helping. Yeah, we're just helping folks. So.
Helping folks, right. So for anyone who's listening, it's okay to call. It's okay to get help.
Exactly.
It's okay. It's a safe place, right, Dr. Wisbey?
Yes, ma'am. Yes, it certainly is, but nobody knows that till they can take the opportunity to try it out, and then tell folks if you're comfortable or not. And we really encourage that, so that we can find the right fit, even with the right clinician. It's not always we have enough therapists to say what would be best to work for you, and someone with maybe the same age, same race, same kind of, it would be maybe even a better calling card. And so we will work with folks to address that as well, because we want comfort and safety as well.
That's right. That's right. Well, Dr. Wisbey, thank you so much for being on this special edition of Conversations on Cannabis We really appreciate having you and sharing your knowledge with our listeners and viewers.
Thank you, Heidi. I appreciate it. Take care.
All right.
I'll
Thank
be in
you.
touch. Bye-bye.